After 5 years as a staff nurse, Cito quit her job to work for a private agency.
It came down to just burnout, I think, mentally, emotionally, physically.
More money and less stress. The choice, she said, felt both selfish and necessary.
That's definitely one of the biggest reasons why I left. And now that I'm an agency, I have 100% control over my own schedule.
Agency nurses are in demand. At Toronto's University Health Network, one of the largest hospital networks in the country, there's been a dramatic spike in spending on agency nurses in the last year.
About $7 million, which is considerably higher, 560% higher than our average spend.
UHN isn't unique. According to a recent Toronto Star investigation, some of the largest hospitals in the province have increased spending on temporary agency nurses by millions of dollars. Nurse unions worry public dollars going to private agencies make it even harder to get staff nurses the wages they deserve.
Currently, agency nurses is costing the system millions of dollars that do not need to be spent.
The cost is more than just a spike in spending, says Cito.
I don't think it's sustainable at all. I don't think it's the safest way. Again, agency nurses are kind of brought in by the hospital. They're not hospital staff.
There really isn't an alternative. So if we can't adequately staff for urgent and emergent care, then we really are closed to the system.
Sido says she eventually wants to go back to a staff job when working conditions get better.
At the end of the day, I think we have to look out for ourselves first in order to care for patients effectively.
The Ontario government has promised to ease the staff shortage by approving more foreign-trained nurses and working with nursing colleges. Chris Reyes, CBC News, Toronto.